Amanda Moore, Stacey Roach, and Dori McGowan work at the Buffalo General Medical Center in the therapy department. Guys, thanks for joining me today.
Thank you.
Thank you.
Before we get into the COVID-19 pandemic and how it's impacted your job, I did want to make sure that our viewers know a little bit more about you. If you can, please tell us a little bit about your role and how long you've been with Kaleida Health.
I've been here at Buffalo General Hospital for almost 3 years, and I'm a physical therapist.
And Stacey, how about you?
I've been here at Buffalo General over 7 years, and I'm a speech language pathologist.
Okay, and Dori?
I've been working at Buffalo General for a little over 3.5 years, and I'm an occupational therapist.
So you guys are part of the rehab department and therapy department. If you can, tell us a little bit about that department and what it does for the patients that you guys serve. Amanda, why don't we start with you?
Sure. I'm part of the physical therapy department. We want to make sure the patients are moving well and also create a safe discharge plan when the time comes for them to leave the hospital.
Okay, and then Stacey, tell us how, from your perspective, how you guys end up getting involved into a patient's plan of care at Buffalo General.
From a speech standpoint, we do a lot of speech diagnosis and treatment in the way someone sounds, their language, cognition, and we also play a big role in the swallowing function of these patients. And typically the doctors order the speech department in after somebody has been extubated or come off the ventilator to see if they can eat and drink. And I guess being specific to COVID patients. Otherwise, we're in there with patients that have had strokes or other neurological issues for their speech and their swallowing.
So I want to talk a little bit about how your job or how COVID-19 has affected you guys as therapists. So Stacey, let's stick with you. In your eyes, the COVID-19 pandemic, how has it changed your role and how you guys are interacting with patients and what you do on a daily basis?
It's changed quite a bit in a lot of different ways. In regards, kind of like what Dori was saying, we have the rehab patients. Those patients don't get the visitors that they were allowed before. So it's really changed the way we have to educate family members. I've done a lot more emails with family members and phone calls. I've even incorporated some of the video conferencing in to my speech sessions with some of the patients and their families. And then as far as the COVID stuff goes, the patients with COVID that we have to go see, definitely changes in how we have to prepare to go into a room, bringing all of our things in that we need, and then also kind of just trusting our instinct because we have to kind of get in and get out as quickly as we can. And we're also a little bit limited on some of the testing that we used to be able to do.
Dori, how about you? Have you seen the role change a little bit since COVID-19? Has it become a little less interactive? Have you been able to spend as much time with your patients as you like?
Definitely not as much time as I'd like. And kind of what Stacey was saying, you have to be more prepared when you go in the room. You have to have everything that you need because you can't just keep popping in and out of the room getting things. I've also noticed that we've been kind of taking on a role beyond our therapeutic scope of practice to where if a patient needs to be cleaned up or if they need something extra, like just things we can get for them. It's been doing more stuff like that, as well as trying to get our evaluations or treatments in a timely manner, but also not to make the patients feel rushed with what we're doing because we are some of the only contact that they have throughout the day. So that's been a little challenging.
Amanda, tell us from your perspective, people may think COVID-19 is only impacting those who work in the emergency department or say the ICU, but you guys have to prepare for each and every patient encounter as if the COVID-19 is in any of the rooms that you visit. Tell us a little bit about that.
Yeah, I feel like a lot of the patients we are seeing at this time in the hospital as a whole are more acutely ill. As I move any patient, I'm constantly monitoring their vitals, how they're feeling. As far as the new PPE that we have to wear in the rooms, it's taxing, donning and doffing each time you go into a room. And like, Stacey and Dori both said, at a time where there's no visitors in the hospitals, I want to be the patient's biggest cheerleader. Any accomplishment that they make is huge. Even if they're just looking at our eyes, we cheer them on. Even if it's just standing up for the day or taking their first steps. Some of these patients have been on ventilation for a long time, and you just need patience, to work with them, to increase their endurance and their strength, and they really need, more support than ever.
Sure. Dori, Amanda used the word taxing. Let me ask you, how do you guys cope with the stress of COVID-19? I mean, obviously the positions that you guys have are stressful enough. The patients that you deal with are obviously very challenged, whether they've had a stroke or they're rehabbing from a cardiac procedure. But this is an added level of complexity. How do you find yourself dealing with the stress?
Yeah, I mean, it can be really hard because I go home and usually I try to work through my stress with my husband, but he just doesn't understand what we're seeing and what we're experiencing here. So I really have just been trying to, get extra sleep. I'm really into yoga. I'm also a religious person, so I've been leaning pretty heavily on my faith through all of this and just praying for easier times to come. And, when I think of how bad I have it, I just think about the patients and know how much worse it could be. So it kind of makes it easier for me to be humbled and know that even though it's hard for me, it's even harder for them.
Stacey, how about you? The stress of the position, what do you tell people when you get home or when people are checking in on you and texting, calling? How are you coping these days?
I appreciate all of that from, friends and family checking in on me. It does mean a lot. I try to just kind of leave it at the door. I try to leave work at the door at home, and kind of the opposite too. I try to leave home at the door at work and come in and just do the best I can every day for my patients. Dori's right. We get to go home every night, and these poor patients, they don't get to go home and they don't get to see their loved ones. I can go home and have the support. So pretty much I try to just be present on where I am and move through the day that way. And it seems to help.
And Amanda, how about you? How do you deal with the stress? I mean, you used the word taxing before. How are you managing through this difficult time?
Yeah, we're very lucky here to have great coworkers to lean on, whether it's in the physical therapy department or occupational or speech. We're all very close. And before this and even during this, we work together very well. I know for the physical therapy department, during our lunchtime, we usually sing a song and we dance. We pick a new song every day, and that's kind of how, we outlet and have some fun. It's very easy to get caught up in, how, painful this is and, taxing and, going through, the emotional roller coasters with the patient. So we try to look at the positive and bring some joy to them. Gotta stay, strong for the patients that we help.
Sure. One of the positives I think we've seen for the last, say, 60 days or so has been the outpouring of support from the community, whether it's, the professional sports organizations or restaurants. They really have done a good job of making sure that the entire hospital workforce is not left out, and they understand how important your work is. Dori, what's your thoughts about the outpouring of support that you guys have seen, or you in particular?
Oh my God, it's been so amazing. I remember reading an email when this first happened, hearing about how the local company, New Era Cap, donated some 5,000 masks to Kaleida. And I just remember thinking, we've got this as a community. We're not alone. There's other people looking out for us. And just having those masks right now is so important to us so that we can, safely and securely do the jobs that we need to do to treat our patients. So whether it's stuff like that or the meals, or we had the flyover today, that was amazing. Like it's so uplifting, and it just reminds us every day that there is hope and that this community is there for each other.
That's great. Stacey, how about you? Your thoughts on the community support that you guys have seen?
I agree with Dori. It's been amazing. And it feels really good to be included in that too. We hear so much about the doctors and nurses who do amazing work. But it really takes so many people to help one person recover here at the hospital. I mean, from the environmental staff to respiratory therapy to, the imaging technicians. There's so many people that go into one person's recovery, I think, that the general public doesn't realize. And it feels really nice to have some appreciation and to know that people are out there rooting for us to help everybody else.
And Amanda, how about you? Your thoughts on the community support and what you've seen over the last couple months?
Yeah, it's been amazing. It's one of the driving forces behind us. Being in the hospital, our bellies are always full from the awesome food that we have been donated, the surgical caps and masks that people are making for us. A lot of different companies are definitely supporting us, and just the community in general, and definitely are feeling the love.
So as we wrap up, I'll give you guys each a chance. Any special message of thanks, whether it's to your coworkers or the community, or anybody in particular you guys want to say thank you to as we wrap up here? Amanda, I'll start with you.
Thank you to all my coworkers, all the hospital staff in general. I see firsthand, what these people are doing, saving lives. As far as the community, we appreciate all the support, and all the families at home who unfortunately have, maybe a loved one in the hospital with this virus. We're here for you. We're taking good care of your family members. They're our family while they're in the hospital, and we're here every step of the way with them.
Stacey, how about you? Message of thanks as we wrap up?
Yeah, just thank you again to all the doctors and nurses and all of the staff here. Everybody seems to have really come together, and it's what we needed to get through this. And again, thank you to all of the community for helping support us, and everybody who's reached out. It helps a lot in a stressful situation. It helps us to keep going every day.
And Dori, you get the last words here. Your message as we wrap up, your message of thanks.
Yeah, thank you to everyone that works in hospitals, nursing homes, those frontline workers, not just us doctors, nurses, therapists, everyone that's out there. It takes all of us to do this together. We are all in this together. We appreciate you so much for making our jobs here much easier, and just keep it up. We'll get through it.
Dori McGowan, Stacey Roach, and Amanda Moore from the Therapy and Rehab Department at Buffalo General Medical Center and Kaleida Health. Guys, thanks for joining us today.
Thank you.